Today we'll dive into why avocados might not be the healthiest choice for everyone. From triggering severe health issues to interacting with medications, we'll explore the lesser-known dangers of this popular fruit. Kidney problems. One of the primary concerns with avocado consumption involves its impact on individuals with kidney diseases. Avocados are extremely high in potassium, a mineral that is vital for maintaining proper cellular function and heart health. While a moderate intake of potassium is generally beneficial, it becomes hazardous for those whose kidneys are compromised. The primary function of the kidneys is to filter and remove excess substances from the blood, including potassium. When the kidneys are unable to perform this function effectively, potassium levels in the blood can rise to dangerous levels. This condition, known as hyperkalemia, poses significant risks to cardiovascular health. Elevated potassium levels can disrupt the normal electrical activity of the heart, leading to irregular heart rhythms which can be fatal if not managed promptly. The risk is particularly high in individuals who have advanced kidney disease or those who are on certain medications that affect kidney function. Furthermore, the high potassium content of avocados is not the only risk factor for those with kidney issues. Avocados also contain compounds that can interfere with the treatment of kidney diseases. For example, certain elements in avocados can interact with medications used in managing kidney conditions, altering their effectiveness or causing undesirable side effects. Several studies have highlighted the risks associated with high potassium intake in individuals with kidney disease. A study published in the Journal of Renal Nutrition emphasized that managing potassium intake is crucial for patients with compromised kidney function to prevent hyperkalemia. The study suggests that dietary management, including the careful monitoring of foods high in potassium, like avocados, is essential for maintaining safe potassium levels. Given these risks, it is recommended that individuals with kidney disease consult their healthcare provider to determine a safe level of potassium intake. This is particularly important for those whose condition is severe or who are undergoing treatment that affects potassium levels. Health professionals can provide personalized advice based on the individual's health status and the specific stage of kidney disease. Liver conditions. Avocados, renowned for their beneficial fatty acids, might not be suitable for everyone, particularly those with existing liver conditions. The high fat content in avocados, though generally healthy, can exacerbate symptoms in individuals suffering from liver diseases, such as fatty liver disease or cirrhosis. These conditions often impair the liver's ability to process fats efficiently, leading to further complications. When the liver is already compromised, the additional intake of high-fat foods, including avocados, can increase the liver's workload. This may accelerate the progression of liver damage, leading to more severe health issues over time. For instance, in non-alcoholic fatty liver disease, NAFLD, excess fats are stored in liver cells, worsening the condition. A study published in the American Journal of Clinical Nutrition found that while healthy fats are essential, their overconsumption in individuals with liver disease can lead to adverse effects, including increased liver inflammation and fibrosis. Moreover, the liver plays a crucial role in metabolizing nutrients, and any impairment can affect the overall metabolism of fats. Avocados are rich in oleic acid, a monounsaturated fat that is typically considered beneficial for heart health and cholesterol levels. However, in the context of liver disease, managing fat intake, even from healthy sources, is vital to prevent potential exacerbations of the condition. Allergies and sensitivities. Turning to allergies and sensitivities, avocados can be particularly problematic for individuals who exhibit allergic reactions to this fruit. Avocado allergies are not as common as other food allergies, but they can induce severe reactions in susceptible individuals. The symptoms of an avocado allergy can range from mild to life-threatening, including skin reactions, gastrointestinal distress, and in severe cases, anaphylaxis. The allergy to avocados is often associated with latex allergy, known as the latex fruit syndrome. The body's immune system mistakenly identifies certain proteins in avocados similar to those in latex, triggering an allergic response. A review in the Journal of Allergy and Clinical Immunology notes that individuals who are sensitive to latex may also react to avocados, and caution is advised when consuming this fruit. For those with avocado sensitivities, even small amounts can trigger symptoms. These reactions are not limited to the ingestion of the fruit. In some cases, even skin contact with avocado can elicit an allergic response. This can pose a significant limitation on dietary choices and requires careful attention to ingredient lists and food preparation methods to avoid accidental exposure. Medication interactions. Avocados, despite their many health benefits, have a lesser-known downside. They can interact with certain medications, potentially altering their effectiveness. This interaction primarily concerns medications that are metabolized by the liver, as avocados influence liver enzymes that are crucial for drug metabolism. Impact on liver enzymes. The liver plays a vital role in the metabolism of most medications. It houses a range of enzymes that help to break down drugs, facilitating their eventual elimination from the body. Avocados contain compounds that can inhibit or stimulate these enzymes, leading to altered drug metabolism. This effect was highlighted in a study published in the Journal of Agricultural and Food Chemistry, which found that certain compounds in avocados could inhibit cytochrome P450 enzymes, a key group involved in drug metabolism. When avocado consumption affects these enzymes, it can lead to higher levels of medication in the blood, increasing the risk of side effects, or conversely, it can cause drugs to be metabolized too quickly, reducing their efficacy. This is particularly concerning for medications with a narrow therapeutic range, where maintaining a precise balance in the bloodstream is crucial for treatment efficacy and safety. Specific medication interactions. Avocados can significantly impact the effectiveness of certain medications, notably blood thinners like warfarin and cholesterol-lowering drugs such as statins. These interactions arise primarily because avocados influence liver enzyme activity, which plays a crucial role in drug metabolism. Interaction with warfarin. Warfarin is a commonly prescribed anticoagulant used to prevent blood clots. The metabolism of warfarin can be altered by avocados, which may either enhance or diminish the drug's effect. This alteration can lead to significant health risks, such as increased bleeding or clotting, depending on how the avocado affects individual metabolism. Warfarin's activity is also influenced by vitamin K intake. Since avocados are high in vitamin K, they can lead to variability in the drug's effectiveness. Patients on warfarin are generally advised to keep their vitamin K intake stable to avoid affecting the efficacy of the drug. Therefore, introducing avocados into the diet of someone on warfarin could complicate management of their treatment, necessitating careful monitoring and possibly dosage adjustments. Interaction with statins. Statins, used to lower cholesterol levels in the blood, are another category of medication that can interact with avocados. These drugs are metabolized by liver enzymes that avocados can influence. The fatty content of avocados may enhance or inhibit the metabolism of statins, potentially requiring adjustments in medication dosage to achieve desired therapeutic effects. It is crucial for patients using statins to discuss their avocado consumption with healthcare providers. This dialogue ensures that any potential interactions can be managed proactively, maintaining the drug's effectiveness and keeping blood lipid levels within a safe and therapeutic range. For both types of medication, the key to managing these interactions effectively is open communication between the patient and their healthcare provider, coupled with careful monitoring of the patient's health and response to their medications. This approach helps ensure that the benefits of both the dietary intake of avocados and the medications are maximized, while minimizing any adverse effects. Guidelines for managing interactions. Due to the potential interactions between avocados and certain medications, it is crucial for individuals prescribed such medications to seek guidance from healthcare providers before making dietary changes that involve avocados. These interactions, mainly concerning drugs metabolized by liver enzymes, necessitate a careful approach to diet for those undergoing treatment with medications susceptible to such effects. Healthcare professionals can offer tailored advice based on a patient's specific medications and overall health condition. This personalized guidance might include adjustments to drug dosages to counteract any interactions caused by avocados. Such adjustments are vital in maintaining the effectiveness of medications while preventing potential side effects that could arise from altered drug metabolism. Moreover, patients are encouraged to actively monitor their response to medications if they regularly include avocados in their diet. Observing any changes in symptoms or noting unusual side effects can act as important indicators of how avocados might be affecting the efficacy of their medication. This vigilant monitoring helps in identifying any unexpected drug interactions early, allowing for timely adjustments in treatment. This proactive approach ensures not only the effectiveness of the medication, but also safeguards the patient's health by minimizing the risks associated with unexpected drug interactions. To recap, avocados, while generally healthy, can be harmful to individuals with specific health conditions. From kidney issues to unexpected allergic reactions, it's essential to know these risks. So, before you next indulge in that avocado toast, consider if it's the best choice for you. Thanks for watching, and stay healthy.